Hello, good evening, Mr. Shinde.
Good evening, sir. Namaste.
Namaste, and very nice to see you after a long time. Now, since we have met now, I have a few questions on a subject which is of importance to everyone in
Okay.
society. It's about mental health and illness.
Okay.
And the first question I'd like to ask you is, what does the term mental health generally mean?
Mental health, in simple words, means a sense of mental well being and emotional well being in the overall system of any human being. In other words, it means that a person is productive. He or she is able to productively execute all daily routine tasks and all other professional tasks. The person has a sense of comfort within, and the person is able to cope up with stress and also develop resilience towards stress. The person feels even physically comfortable and along with being mentally comfortable. So this is what is mental well-being, because mental well-being also has a connection with physical well-being.
That's wonderful. And the relationship between mental health and mental illness, can you explain that, please?
Well, just now I mentioned to you that mental health is basically overall good quality psychological well-being. Mental illnesses, when you are not able to think with clarity, you are not able to process thoughts in an appropriate manner, you are not able to act and behave properly with people around you, that is friends, family, colleague, etc. And overall there is a sense of uneasiness and discomfort in your mind, in your heart, and in your overall physical system, where you feel fatigued and you don't feel energetic. So, I have explained to you mental health and mental illness in very simple words rather than using very, very high technical words. And this is something that all of you can understand.
That's a very nice explanation, clear and concise. Now, the general indications of mental health, how do you recognize it?
See, when a person for a long duration of time feels hopeless, there is long term sadness, there is low self confidence, there is low self worth, there is low self esteem, there is a sense of nervousness towards any task that is presented to you or that you encounter. There are intermittent or consistent anger outbursts. There is a constant sense of irritability towards people communicating with you, or various elements in the environment when they are interacting with you. There is that nervousness, there is that sense of anxiety, overthinking, there is some kind of a fear. Overall, you feel very fatigued, you don't feel energetic. This is what, in very simple words, are indications of poor mental health, or mental illness as such. Yes.
Wonderful. And the most common mental illnesses or mental health disorders, what are they?
There are many mental health disorders. The whole subject of mental health disorders is very large. But the most commonly found mental health disorders are depression, anxiety, bipolar mood swings, then obsessive compulsive disorder, emotional instability, post traumatic stress disorder, and there is one more which not many are aware but which is commonly found in many people, is personality disorder. And within personality disorder there is a category known as the borderline personality disorder. Like that, there are many categories and many classifications of mental, but these are the ones which are common.
So that you'll know only when you speak with the patient and interact with them.
Yes, one has to make a mental status examination and examine the symptoms of the patient, and one has to be well versed with the symptoms of various mental health disorders, which only a qualified and experienced mental health professional can do.
That's exactly like who you are.
Exactly, sir. Yes.
Thank you so much. Wonderful interacting with you. Keep it up.
Thank you, sir. Namaste. Pleasure talking to you. See you soon.